So the esophagus and the stomach are really important in the process of digestion. The esophagus, obviously, because it carries food or the bolus to the stomach from the oral cavity. And then the stomach is going to continue this process of mechanical and chemical digestion. So in this lecture, we're going to start off by looking at the surface anatomy, the position of the esophagus and the stomach. We'll then look at the esophagus and stomach individually, looking at the blood supply and the anatomy of the esophagus within the abdomen. And then we're going to move on to the stomach and look at its structure, talk a little bit about gastric ulcers, how they're formed, and also look at the blood and nerve supply of the stomach. So if we start off with just some nice key facts about the esophagus. Well, the esophagus is a hollow, it's a muscular tube. It's about 25 centimetres long, but obviously this can vary from person to person, and it has a diameter of about 2 centimetres. It's a muscular tube and it carries out peristalsis, and that means this contraction of the muscle fibres allows the food to pass down from the pharynx in your throat to the stomach. To do that, it has to pass through the thorax, and it runs posterior to both the trachea and the heart. So in your neck, most anteriorly, you can feel the trachea, and immediately posterior to that, you have the esophagus, and then it runs directly posterior to the heart. It then opens up into the stomach, which is really this muscular expansion of the gastrointestinal tract. And if you remember from surface anatomy, it's located within the epigastrium and umbilical regions. It can sometimes extend across into the left hypochondrium. And it stores the ingested food, the primary function of it. It also mechanically churns the ingested food into smaller fragments that increase the surface area, allowing for gastric juices to carry out the chemical digestion. And ultimately, it converts this ingested bolus of food into a semi-liquid, which is known as chyme. And this is then expelled into the rest of the gastrointestinal tract, initially the duodenum, part of the small intestines. As we'll see, the stomach can be divided into numerous regions, and we'll look at these in more detail: the cardia, the fundus, the body, and the pylorus. So here, if we look at the surface anatomy for the esophagus and the stomach, we can see we've got our clavicles up here, and we've got our rib cage, we've got our ribs, and we've got the midline. And the esophagus pretty much runs down that midline towards the stomach. And to do that, it has to penetrate the diaphragm, which we'll see in a moment. And then here we can see the stomach tucked under some of those ribs on the left-hand side, this kind of J-shaped muscular sac, which will then be continuous with the duodenum over in this direction. We can see that if we superimpose these kind of cartoons of these images, of these organs, onto the person's torso. We've got the liver here, which is shielding some of the stomach. We can see we've got the esophagus that runs down into the stomach, which we can see here. Then the stomach is going to pass the food into the C-shaped duodenum, which is the first initial part of the small intestines. So we can see the general layout, the general position of the esophagus and the stomach in these pictures here.